Hiya. I thought I would introduce myself to start this presentation on wellbeing and archaeology. So I'm Rachel. I graduated from a master's in field archaeology at the University of York in January this year, and I've worked in commercial archaeology, community archaeology, and in the museum sector since July last year. So this research came about from a secondment I did with the community engagement team at the York Archaeological Trust. And this team have a groundbreaking social prescribing project, which is aimed at helping people with learning difficulties, mental difficulties, or people who might be in rehab, help them through archaeology. So with this presentation, I aim to highlight the impact of projects such as these and how these projects the impact they might have on participants and on the staff involved. So a bit of background. In 2015, the archaeological industry began to develop wellbeing projects. These had existed previously in the heritage industry with projects such as Missing Pieces Community Toolkit and the Heritage Connectors project, but none of these really involved archaeology until the Breaking Ground Heritage project, which worked with Operation Nightingales and aimed at bettering the mental health and the wellbeing of ex-military personnel. So another recent archaeological-based project is Project Rejuvenate, which was run by Historic England, Wessex Archaeology and Isle Heritage. And that aimed to expand the capacity of vulnerable young people where it might be suppressed by circumstance, education or self-belief, and basically aim to build a stronger connection to the historic environment. So this research will touch a little on Breaking Ground Heritage's project, but it will largely focus on York Archaeology's Archaeology and Prescription project due to my affiliation with it, and throughout I may call it AOP. So the project aims to highlight the positive impact archaeological wellbeing projects can have on both participants and on the staff involved in the project. But I also aim to document the diversity of the community projects these projects involve. So it might include ethnic backgrounds, age, physical abilities. But also through this research, I hope to show how these projects have had a positive impact on participants and how it may have changed their views of their own capabilities. So, why is it relevant? This research is particularly relevant really because by raising awareness of community engagement projects within the archaeology sector, which are aimed at improving people's well-being, it kind of opens people's minds to the importance of archaeology within the community and shows that it is more than just digging the past. So alongside this, by compiling this information together, it's a good source for identifying the improvements archaeology is doing in the wellbeing sphere, and how community archaeology projects serve as an excellent purpose to helping people. So this research will highlight the importance of social prescribing projects such as archaeology and prescription, and how taking part in something which is hands-on, mind-freeing, sometimes physically freeing, can positively benefit people, both the staff and the participants. So briefly, what is community archaeology? So the London archaeologist defined community archaeology as a wide variety of projects that are designed to involve local people. Now these projects may vary from researching the built environment to excavating historical sites across the country. But excavation isn't the only thing they involve. So they also cover other aspects of archaeology, including past excavations, so people might get more hands-on with finds washing than just the digging side of things. So it's something that will keep people's minds moving as well. So there are some organisations which do focus solely on working with the community, such as Dig Ventures, and other ones, commercial units such as Archaeology, York Archaeology or MOLA, who focus on the community as a whole, both the paying public and the wellbeing side of things, and that is what I'll be focusing on here. So what is wellbeing? What Works Wellbeing does define wellbeing as how we are doing as individuals, communities, and as a nation, and how sustainable that is for the future. And we, as a community archaeology side of things, focus on the individual and the community more, and how the two might link together. So the heritage industry has collaborated with organisations and focused on improving people's well-being, highlighting the importance of doing something you find interesting in improving your well-being. So with archaeology moving into this sphere, it kind of further highlights the significance of this collaboration, and that the projects that we're talking about will highlight the significance further. Okay, so the first of the two case studies I will look at is Breaking Ground Heritage Project. I won't be going into too much depth, however, I do think it's important to talk about the project, which sparks the convergence of community archaeology and wellbeing. So as I mentioned, it works alongside Operation Nightingale to develop both the heritage and archaeology projects to help the recovery of ex-military personnel. So this project opened up a lot of educational and employability pathways to people through partnering with universities and commercial units, and enabled participants to build quite a good network. And in 2018, a research program was formed by Breaking Ground Heritage's psychology team to understand really the success of the project. So they looked at the levels of anxiety, depression, and the general well-being of the participants from the second week of the project to the last week of the project. And the results of this research really highlighted that the project was having a positive impact on people. It was positively affecting participants. So kind of showing the success that community engagement projects can have within archaeology. And so giving positive insight into what other projects can do as well. So the other case study I will talk about is archaeology and prescription. So AOP does work alongside people in York and the surrounding area to help improve their well-being through archaeology. So currently the project's taking place at a former care home called Villa House on Walgate, and the participants will work with archaeologists to improve their health and well-being whilst learning a new skill, learning archaeology. So the participants aren't forced to do anything. They can turn up, have a cuppa, have a chat, or they can get into the trenches and do some excavation, or sit at the finds table, do a bit of washing, bagging, find sorting. It's completely up to them what they want to do and what they get out of this program. And so the project itself does pride in being very accessible, because whilst it's only in its second year of the pilot program, it has had a wide variety of people with physical and other needs come through its gates. And in most recent seasons, we have seen a wheelchair user, people who might have medical conditions that changes how their physical ability is day to day, or people back in joint pain. And as a result of that, we have made it a very accessible excavation. So we have an excavation, a trench that people can use, do excavation from the surface, making it easy to get in and out of the trench, but we also have expanded on the trench, meaning people can sit on stools and excavate at head height, meaning that they do not have to impact their backs at all. So making it as easy and as accessible as possible to participants. The participants who are involved in archaeology and prescription are directed to the project through organisations such as through NHS social prescribers or through community groups, and the staff are all trained archaeologists as well. So we are there and we know what we are doing. The senior staff are also mental health first aid trained due to the needs of some of the participants, because some may come from rehab groups or have prior mental health issues. So we aim to have the best knowledge and be there as well as much as we can for the participants. And as a result of that, we have quite a high staff to participant ratio. We have 2 participants to 1 staff member, meaning we can provide the best experience and the best care to our participants. So I thought I would talk a little about the community project's impact in both staff and participants. And so from working as a host in archaeology and prescription, I've experienced firsthand the impact archaeological wellbeing projects can have on participants and on the staff. And as a staff member, I've felt a noticeable improvement in my own mental health. So that comes from talking about something I love with participants who are also interested in the subject. It was very freeing. It was also an incredibly rewarding job. Seeing people improve and get excited about archaeology kind of just really rekindled my love for archaeology. And so I did ask a couple of the other staff members who work on the project how it has impacted them, and I have included their quotes here on the slide. The most recent host, who took over from me, talked about how rewarding the job is as well. So they talked about how spending time talking to people about their passion and how this is beneficial to the participants' lives really improved their own well-being. So whilst one of the project officers also talked about how sharing archaeology with people who may never have had the opportunity to experience it before and seeing their joy about archaeology is just wonderful, and it sort of reminds them of the reason why they started archaeology in the first place. So I think it is important to remember that we as staff are as much a part of the project as the participants in many ways. So as I said, the participants on AOP are on it for an array of reasons, and for the purposes of this presentation and confidentiality, I won't be mentioning their names or any of the reasons why people might be there, but I can talk about how I have seen a noticeable change in people over the 8 weeks that I was working on it. So at the start of the spring season, I saw people very quiet, not wanting to talk, really making you work for that conversation. And by the end of the season, they were starting the conversations and talking, really coming out of their shell. In other cases, people who thought they wouldn't be able to excavate because it would hurt themselves, we couldn't keep them out of the trenches by the end of the season. And people were flying up and down the steps in and out of the trenches, whereas at the start, they were leaning on us to get in and out. So their own awareness of their own capabilities really did improve over one season. So it is incredibly humbling to see people grow like this. I think this really just shows the impact that community projects can have on people's wellbeing, and it really is just inspirational. And one of the project officers talked about how the warm, open environment that we provide, that is very welcoming, really puts participants at ease and does lead them to enjoying themselves more and learning new skills and being part of a team. So it really does further highlight the positive and beneficial impact community archaeology projects such as this is having on people's wellbeing. So the evaluation process of this project is still ongoing, and it's important for the community engagement officers to gain quantitative and qualitative data so they can produce research on the impact this project is having on people, both from the start and the end of their time on the project. So similar to the research conducted by Breaking Ground Heritage. Now I will just finish by looking at reflecting the diversity of participants coming into projects such as AOP. And I thought I would start with looking at the ability. So I've touched on the various groups that pass through with mental difficulties, physical difficulties, learning difficulties. And there are also two groups that have their own time slot, a group with more severe learning difficulties who may need a one-on-one person with them, and a group from a rehabilitation group. And so this really is showing the wide variety of people this project is attracting, but also how it is bringing people from different parts of the community with different backgrounds together. So it's quite nice to see people working alongside each other who might not interact otherwise. And whilst we do get a range of people from different age groups, so we start at 18, young adults, and we go into pensioners, maybe we get people in their 60s, maybe 70s. So we do get a wide variety of people coming into this project. What we don't see a wide variety of in this project, in archaeology description, is ethnicity, and that is simply due to the background of people who live in York. It's not an ethnically diverse area, neither is North Yorkshire, and so that is a difficult area for us to attract to this project. However, it's something we are aware of, something we want to try expanding to further, and if projects such as this do expand beyond York, if they go into other cities, the diversity in those areas may be different, and the project may attract more ethnic diverse people. But it is something this project does like, but it is very aware of, and there is very little we can do about it due to the scope that they attract, they're bringing people in from. So thought I'd just finish on the slide with some references of the things I've been using within this presentation, and I hope you enjoyed it. Thank you.